Hi, it's Astrid and Risa,
and welcome to our first video.
Depression. What is depression? Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act.
Fortunately, it's also treatable. Depression causes feelings of sadness and or a loss of interest in activity one enjoy. It can lead to a variety of emotional and psycho problems and can decrease a person's ability to function at work and at home.
In grief, painful feelings come in waves, often intermixed with positive memories of the deceased.
In major depression, mood and or interest pleasure are decreased for most of 2 weeks.
In grief, self-esteem is usually maintained.
In major depression, feelings of worthlessness and self-loathing are common.
For some people, the death of a loved one can bring on major depression.
Losing a job or being a victim of sexual assault or a major disaster can lead to depression for some people.
When grief and depression coexist, the grief is more severe or less longer than grief without depression.
Despite some overlap between grief and depression, they are different.
Discussing between them can help people get to help, support, or treatment they need.
Several factors can play a role in depression. 1. Biochemistry. Differences in certain chemicals in the brain might contribute to symptoms of depression.
2. Genetics. Depression can run in families. For example, if one identical twins has depression, the other has a 17% chance of having the illness sometime in life.
3. Personality. People with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression.
And 4. Environmental factor. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression.
How is depression treated? Depression is among the most treatable of mental disorder. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and possibly a physical examination. In some cases, a blood test might be done to make sure the depression is not due to a medical condition like a thyroid problem. The evaluation is to identify specific symptoms, medical and family history, cultural factor, and environmental factor to arrive at a diagnosis and a plan of courses of action. Medication. Brain chemistry might contribute to an individual depression and might factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedative, or tranquilizer. They are not habit-forming. Generally, antidepressant medication have no stimulating effect on people not experiencing depression. Antidepressant might produce some improvement within the first week or 2 of use. Full benefit might not be seen for 2 or 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressant. In some situations, other psychotropic medication might be helpful. It is important to let your doctor know if a medication does not work if you experience its effect. Psychiatrists usually recommended that patients continue to take medication for 6 or more months after symptoms have improved. Longer-term maintenance treatment might be suggested to decrease the risk of future episodes for certain people at high risk.
Psychotherapy. Psychotherapy or talk therapy is sometimes used alone for treatment of mild depression, for moderate to severe depression. Psychotherapy is often used along with antidepressant medication. Cognitive behavioral therapy has been found to be effective in treating depression. CBT is a form of therapy focused on depression and problem solving. CBT helps a person to recognize distorted thinking and then change behaviors and thinking. Psychotherapy might involve only the individual, but it can include others. For example, family or couple therapy can help address issues within this close relationship. Group therapy involves people with similar illness. Depending on the severity of the depression, treatment can take a few weeks or much longer. In many cases, significant improvement can be made in 10 to 50 sessions. Electroconvulsive therapy or ECT is a medical treatment most commonly used for patients with severe major depression or bipolar disorder who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia.
So guys, that is the explanation about depression from us. Hope you enjoyed this video.
Thanks for attention. We don't apologize if have a mistake with our speaking.
And
Thank you, bye! Hai, it's Astri and Risa. Aku udah ngomong. Hi, it's Astri and Risa.
and welcome to our first video.
Kau suruh tiga tadi.
Sekarang 2, 3.